Hello, everyone, and welcome to some third year tips and tricks. My name is Jake Hunsaker. I'm a fourth year medical student at Rocky Vista University College of Osteopathic Medicine. And I made this presentation because there were a bunch of questions I had at the beginning of third year and that I have heard from new incoming third years that are just questions that should be answered, and I wish someone would have answered for me. So my goal with this presentation is to just run you through a handful of things that will make your life easier over the next year. This is what's on the agenda for this presentation today. I will show you guys some shelf prep stuff, the resources I used. I'll go through audition rotation timelines and what to do and when. I'll tell you about my dedicated period and how I approached that, as well as just some quality of life, general tips and tricks to help make this year the best as it can be. So shelf stuff. I'm going to show you guys the resources I used, give you a quick outline of the schedule that I kept throughout each week, and then how I used OnKing and UWorld to do well on these exams. So the resources I used are listed here. They're given in order of most valuable to least valuable. UWorld and the OnKing QID search were certainly things that I felt were an absolute necessity. UWorld and Amboss are both regarded as kind of the gold standard for QBanks. Just whichever one you decide to use, just pick that one and go for it. I personally used a little bit of both, and I found Amboss to just be a little bit too convoluted and difficult for what I needed to learn. Do keep in mind, though, that UWorld is a question bank, so each shelf exam has a dedicated amount of practice questions on each UWorld section. And if you do all of those questions, you will have covered everything that UWorld thinks is necessary or that could possibly show up on your shelf exam. Now, to contrast that, the NBME practice exams, which I have listed second, those are not QBanks, but they are written by the same people who write your shelf exams. They are not all-inclusive. They don't cover everything that you could possibly see, but they are a good compilation of what the NBME thinks you need to know as you go into an exam. And I will say that as you guys do thousands of questions over the next year, that you'll start to notice and be able to feel a difference between UWorld and NBME questions. So I think it's valuable to use NBME as well, because it feels the most like what your shelf exams feel like. Emma Holiday and Dr. High Yield are both YouTube channels that have a comprehensive lecture review for each shelf exam. The way I used this was about a week prior to the shelf, I would watch that video and see if I could kind of answer the questions as they were describing things. And that helped me have a full review of everything that I might see. It also highlighted things that I might need to review and look over again before my test over the next week. Fourth on the list is Sketchy. I thought Sketchy was a fantastic resource, and I preach it to every first and second year. But during third year, it wasn't as helpful for me for clinical medicine. It's really great for memorizing micro and pharmacology and things like that, and it helped me build a strong foundation. But when you get into clinical medicine, it's much more algorithmic, like this patient has this, what's the next step here, is it A, B, or C, and it helps you move that way. And I didn't feel like Sketchy taught me that quite as well, but if you have a subscription and you're a Sketchy lover, then go for it. The last thing on the list here is the Divine Intervention and MedGeeks podcasts. Those were very helpful as far as feeling productive when I'm driving. Definitely the lowest yield. I didn't see a lot of stuff that was reviewed on those podcasts on my shelf exams, but it helped me to be intellectually stimulated as I was driving around or doing this or that. And there were a few things that did show up. So if you like podcasts, those are both good. Here is a snapshot of my weekly schedule that I maintained throughout third year. The fun thing about third year is over the first 2 years of your medical education, you have been a student day in, day out, But now you are working, you have a day job, and you're going to night school. So the schedule doesn't look that busy, but it certainly can be. So Monday through Friday is just you're working in the clinic or the hospital or whichever rotation you're on. And sprinkled in throughout the workday is UWorld and Anki. And then in the evenings is UWorld blocks of practice questions. Saturdays were reserved for NBME practice exams. My strategy with those was to start with the newest exam and work to the oldest. Because if you start with the newest exam, you'll see the most relevant, most recent, pertinent information the earliest, and it will give you the whole month of the rotation to learn it the best. And then by the end of the rotation, if you're just taking these old ones, there's some antiquated material in there, whatever, you can just throw it out. You don't have to worry about it. And then Sunday was just cards and rest and relax for a little bit of mental recharge. So here's a word on UWorld and OnKing. OnKing has a QID search add-on, which I'll explain and show you here in a second. In order to have access to this, you will need to become an OnKing VIP member. There's like a $5 a month subscription that I did, and that gives you access to daily updates on your cards. I think there's 40,000 something flashcards that they're constantly updating, constantly adding new material to. But the most important thing is this QID search. So the QID search, when you finish an exam in UWorld, you have this window that will show you your exam, like each question, your percentage, all that good stuff. And over here there's a drop-down menu that shows that has a bunch of check boxes. And from there you can select or deselect whatever you want, but I would select the incorrect and the questions that I marked that I had a hard time with. After selecting those, there's a button here in the top right of the window called Question List. And when you select this, it brings up a pop-up box with. This is what the pop-up box will look like, and it will have a question list of just a string of numbers for however many questions you missed or flagged. And once you copy this, it allows you to copy and paste that into this add-on. And from there, the add-on does the magic. It filters through 40-something thousand flashcards for any flashcard that has been tagged with that specific question ID. So you can instantly have pre-made good flashcards for all of the questions that you missed or flagged. And from here, in your browser, you can choose which ones you want to suspend or unsuspend based on what you feel like you need in order to best learn the material. Now, changing gears a little bit onto the third year timeline, I just don't want you to make the mistake that I did, wherein I thought third year would be more of this longitudinal exploration of specialties and be exposed to a bunch of different things and decide what you like, which it is, and there's a lot of good stuff there, but things happen a lot quicker than that. So here's a brief timeline. September of things you should be doing through this year. September to December, you should start gathering documents and researching programs where you might want to do audition rotations for whatever specialty you are most interested in. Some of those documents include standardized AAMC immunization form, your certifications for ATLS, BLS, things like that, an updated CV. You'll want all those as you get the ball rolling for auditions. January, February is start exploring VSLO. Start looking at it, upload things where you can, start saving programs where you want to rotate. And that will continue through March and April. And you'll definitely want to start applying for auditions as they open, because some of them open as early as February and then into the spring. So start looking for those and apply early, because you don't want to be the last one, especially if you're doing a specialty that is a little more competitive, because those spots fill really quickly. Also during this time, you'll want to start a draft for your noteworthy characteristics and residency personal statement. Those things are a pain, and it never hurts to start getting an outline. going so you don't have to stress about it as much later. And also the fun stuff is planning and preparing for your dedicated board study prep. Then May to June is going to be when you are doing your dedicated board prep and taking boards. And depending on how early you started registering and applying for audition rotations, you can start doing those as early as late June. So keep an eye out for those because they come quick. And then the last thing you want to start doing through the summer is start working on your ERAS worksheet. The actual ERAS application doesn't open till later, but you do have access to this ERAS worksheet that's just an outline and shows you all the stuff that you'll need, and you can start writing about experiences and personal statements and all that kind of stuff. Now we can get into some fun stuff about dedicated board prep. This is just a quick word on how I did it. As a disclaimer, I took both Step 2 and Level 2 about a week apart, and scored in about the 50th percentile on both of them. So take this advice however you'd like. You're going to get a lot of it from a lot of different people over the next year. So just pick and choose what you like and ditch what you don't like. This is how I did it, and this is what worked for me. So I took about 6 to 7 weeks. The first 2 weeks I had to finish my UWorld QBank. My recommendation to you would be to try and finish it before, get a full first pass before you get to your dedicated period. That way you've at least been exposed to all the material once. And then weeks 3 to 6, I scheduled it to where I took a half-length practice exam every other day, and I reviewed it on the off days and made flashcards for it on the off days. And then once I finished taking all the practice exams that I had access to, which I think ended up being 15 or 16 practice exams, I just started retaking them and revisiting them and trying to do as good as I could on them. The reason for that is once you're that far into your dedicated period and you finish third year, these resources shouldn't be teaching you new material, but they will be testing you on all the different weird ways that question writers like to ask questions about certain topics. So you're not going to read a question and be like, oh yeah, this is diabetes, that's easy, and then move on. You're going to have some really weird presentation or like a niche thing that is really rare, but the more practice you have answering questions like that, the better off you're going to be on test day. And then just a word on the day before tests. The only thing I did on the day before my exam, nothing new was going to get in there that day, so I just did my review cards and then I took the rest of the day off. Went to the pool, went for a hike, went to the gym, just did fun stuff. Now here's the question that is on every DO's mind as we approach Step 2, is to take or not to take. And I'll just give you my 2 cents on what I think. If you have a good chance of passing, take it. If you're not sure, or if you have a low likelihood of passing, or maybe you didn't pass Step 1, you don't have to take it because there's lots of changes that are happening that are becoming, programs are becoming more DO friendly. They're accepting COMLEX Level 2 in place of Step 2. But just remember that of the large list of programs across the country, if you don't have it, you will be narrowing down your options. Does that mean you won't match? No. It just means that you have less options to choose from, because if a program requires Step 2, you can't apply there. So take it if you can. Don't stress about it too hard if you don't take it, but recognize that you will have to do some more planning and you'll have less options for potential programs to go to residency. So now I'll just finish off with a couple of general things to help you stand out in a good way, hopefully. This is just a bookkeeping thing. So I don't think anybody shows you how to do this. Your institution might use a different program. This is what ours looks like. This is how you log cases. So on the top of the screen you'll see a drop-down menu where you'll want to select the specific rotation that you're on. From there, you can fill in the required information. On the left is for a general, like a normal core rotation. This is what it looks like. And I just want to point out that the only things that have asterisks that are required are patient age and the procedure you performed. So you don't need a lot of information there. The OPP department is a little bit more needy with what they want. So just be familiar with the information that you'll need to fill out these OPP case logs. And also be diligent on your somatic dysfunction diagnoses. Make sure that you put the side of the body and make a correct diagnosis, because if anything's wrong with it, they're going to kick it back to you and make you do it again, which is really annoying. Here's a brief list of things that I thought were important and valuable to do at work. There's a joke that there's an inverse relationship between the amount of time that you spend working and to your performance on shelf exams. So if you're working a lot, you're going to not do very well on the shelf. And I don't agree with that. Particularly, I spent by far the most time working during my surgery rotation, and that was by far my best shelf exam. So who's to say? But here are a couple tips. Number one is to get a patient list at the beginning of each day. If you have a patient list, you have their name and age and usually a diagnosis, and that first of all can almost completely fill out your patient log that you're going to need to do, so you don't have to do it from memory. Second, since there's a diagnosis or a chief complaint, you have something to reference when you're sitting with a patient that you don't know and the doctor's just rambling on and talking to them. It just helps you be a little bit more engaged in the experience. The second thing I think is important is to log cases daily. It's easy to get behind on this, and it's not a good look if you have to go back to your preceptor and say, hey, can I have a patient list from Tuesday 3 weeks ago? I didn't log my cases. It's just not a pleasant experience. So if you log them daily between patients or whenever, just get it over with, and you never have to think about it. You never have to worry about it. The next one I think is really important as far as studying at work, and it's using EMR time effectively. There's going to be a lot of cases where maybe a patient doesn't want a student, or the doctor is on a phone call, or whatever it might be, when you just have access to the medical records. And from there, I would recommend going in, reading up on your patients, knowing as much as you can about them, reading notes that the physicians have written, reading ER notes, discharge notes, and looking at diagnostic imaging. Because before too long, you are going to be the one that is writing those notes, and the more exposure you have to medical language and how things are written, the easier it will be to do it on your own. And in addition to that, when you guys are doing thousands of practice questions over the next year, you're going to find that a lot of them will give you an exhibit. They'll give you a CT or an MRI and ask you to make a diagnosis or a decision based on that image. But in more cases than that, they're just going to describe findings. And if you speak the language and you understand how normal is described and how abnormal is described and vice versa and all that stuff, you'll have a huge advantage there. So look at every x-ray that you can, look at every CT that you can, and get good at those. The next thing is just to make the life of your preceptors easier. If you are planning on asking for a letter of recommendation from a preceptor, I would recommend doing it on maybe week 2 or 3 of a 4-week rotation. That way they have a heads up. They can watch you over the next week. They can see things you do well. They'll have more details to add to your letter of recommendation, which makes for a better letter. And it makes it so they don't have to think back and try and remember all the good stuff that you did. And the last thing is just be present, ask questions, and have fun. It's an awesome year. You get to see a ton, you do a ton, you learn a ton, and it's a blast. Even if the specialty isn't your top choice, if you can be present and engaged, you will stand out to your preceptors, and it'll make you a better doctor in the future. So just to finish here, a couple of things that I think are important to do at home. You're going to be doing a lot of practice questions this year, and when you do them, in my opinion, I think that they should be timed. Because your board exams are timed, your shelf exams are timed, so you should practice like you play. You'll start getting this internal clock for about what a minute and a half feels like. and you can start feeling, oh, I'm spending too long on this question. So just do them timed and then review them thoroughly afterwards. Don't worry about missed questions on a QBank. It's a learning experience. So if you pull a 30% on UWorld, it's okay. Just learn it and get better. Another important thing to do is to journal or have a note in your phone or something where you can write down significant experiences that you have over the course of this year. It's so helpful to have a list of profound experiences where you were engaged with medicine, you did something, you saw something, because the conclusion of this year ends with you starting your residency application, which asks for personal statements, it asks for significant experiences. Interview season they're gonna ask you about experiences you've had, and you want a well to draw from when you're put on the spot to answer these questions. And lastly, just a fun thing, your shelf exams will always be on Fridays, which means you have a free weekend. Enjoy those, go out and do stuff. I think you're going to have a fantastic time with this year. That's all I have for you guys today. If you have any questions, feel free to reach out to me via email. I will add links in the description to OnKing, UWorld, Sketchy, and the other things that I mentioned. And if you have additional questions or things that you would like me to explain further, mention it down in the comments, and I'm happy to go through it in the future with you. Good luck!